Policy and Politics with me, Tarun Nangia. Today we are going to discuss the union budget and also very specifically the health sector and some other provisions related to the taxation and other issues. And to discuss this, I have an interesting panel with me. I have with me Kiran Majumdar-Shaw. She is founder of Biocon, which is India's largest biopharma company, and he is co-chair Lancet Citizens Commission. I have with me Yamini Iyer. She is Chief Executive and President Center for Policy Research, which is India's premier think tank. And also she's Commissioner, Lancet Citizens Commission. I have with me Advocate Gagan Kumar, he's lawyer and chartered accountant, and also Advocate Vijay Agarwal, a lawyer and a chartered accountant who's known to defend some of the high and mighty in the country. I would like to thank each one of you for sparing your time for this episode of Policy and Politics. Now, let me first lay the ground for this discussion. There was talk of a 2.2 lakh budget for healthcare in the budget. There was also talk of 35,000 crores being allocated for the rollout of COVID-19 vaccine and 64,000 crores that would be spent on primary, secondary and tertiary healthcare, of course, over the next 6 years. But these are only the headlines. As far as the fine print is concerned, I have with me Kiran Majumdar-Shaw. Ma'am, could you please open the debate with your opening comment?
I think, the pandemic has really brought the focus on healthcare. So for the first time, we saw the finance minister open her budget speech with healthcare. And I think the fact that there is so much attention given to healthcare and the message that has gone very loud and clear is that we are increasing our healthcare budget. There's also a very clear intent of increasing healthcare spends from 1% to 2.5% of GDP over the next 4 to 5 years. And at least, even though we might have some discussions around actual allocations within healthcare because they have included, sanitation and other aspects of nutrition and other things, which is also a very important part of healthcare. I think the good news is that there's so much attention given to healthcare. The other thing is, of course, there has been a one-time allocation given to COVID vaccine procurement. And my request to the government is that now that you have increased and given this one-time allocation for COVID vaccines, I think going forward, this 35,000 crores must be used to address our other disease burden. We have a very huge disease burden when it comes to both communicable and non-communicable disease, like, for instance, cancer, diabetes, and many other non-communicable diseases, but we still have to contend with the likes of TB as well. So I think it is a very good move that's been made by the government. Moreover, the 64,000 crores over 6 years is also a very welcome, allocation to beef up our primary, secondary, and tertiary healthcare systems. My main request here to the government is that whatever we do, I think private sector must also be a co-beneficiary of these increased spends. So going forward, I do believe that it cannot just be restricted to the public sector. Private sector must also be a beneficiary of this increased spend because we have to make it a public-private partnership when it comes to healthcare.
Okay. In about a minute, if you could elaborate on that last point that you made of how to involve the private sector.
See, today it is very well known that when you look at the healthcare delivery, a large part of healthcare delivery is from the private sector. So whether it was in COVID management, whether it was in non-COVID times, I think the private sector is a large, provider of healthcare services. I think the big question we have today is how do you bring out a governance model that makes sure that the private sector is not basically charging more to patients who need their services. And that is why I believe that if you have a allocation from the government for private and public sector healthcare service providers, there needs to be a governance mechanism that allows the most optimal use of the capacity and the capability that is there in the private sector at an affordable level.
Okay. I'll go to Yamini Iyer at this point. Ma'am, there was talk of budget allocation of 6% of GDP for the health sector. We have not touched that level as yet. Given the kind of country India is with a heavy disease burden, we have a lot of problems starting from malnutrition to even being the heart attack capital, diabetes. These all issues also saddle along with other diseases that Kiran Mazumdar-Shaw just alluded to. Do you think there is a long way to go in healthcare for us?
Oh, absolutely. There is a very, very long way to go. I think that, like Kiran said, the pandemic has really brought the healthcare system and its weaknesses and limitations into the forefront of the public debate. That's a very important thing and something that we should be very grateful for, given that health has always been pushed to the sidelines. But I think the real question is how much have we learned from the consequences of the pandemic in order for us to be able to move forward so that we don't face the kind of distress that we have faced over this last year. I think certainly the positioning of health upfront in the budget, the announcement of this new scheme, the Pradhan Mantri Swasthya Atmanirbhar Swasthya Yojana, its emphasis on primary care, which was one of the things that has been missing in policy over the last few years, where we had shifted a little bit more to tertiary and actually the question of the primary, how to strengthen primary care and primary health systems was left hanging in the open. The emphasis there, the emphasis on public health, again, something that COVID brought out very clearly. We need to invest in disease surveillance, we need to invest in epidemiology, we need to invest in R&D. All of those sort of are front and center in terms of the policy direction. But policy direction is only good enough if it is backed up with resources in order for government to also signal its own seriousness to itself as well as to its citizens. There I found the budget quite wanting. I don't think that in a pandemic year it is necessarily appropriate to do fiscal arithmetic to showcase large spends. I think it's perfectly all right in a pandemic year when there are multiple expenditure pressures on government with low revenue and a very high fiscal deficit to say we are committed to raising resources. This is what we can do now. This is what we will do going forward. So I would have welcomed, there was certainly a sort of midterm target of 64,000 crores over 6 years, but I would have welcomed a little bit more realistic detailing about how we would spend rather than saying 137%, to 230 crores, or I forget the exact number, which merged monies from different schemes. I also would like to say that one of the most critical issues in healthcare, in our public health system, is that health is a state subject. And therefore, the federal dimension of what it means for the central government to launch a new scheme or the central government to make a push for health systems investment in terms of what that means, what is the role of the state versus what is the role of the center, is a question that the 15th Finance Commission has tried to work with special grants, health grants to states. And that's really at the heart of the challenge we will confront. So how the center and state negotiate the role of their own role in the provision of health and where the funds will rest is going to be a very important question for the future that needs to be understood better and addressed.
One quick question before I move to Vijay Agarwal here. Ma'am, as far as hospitals are concerned, state governments have given them higher FSI for building hospitals. 2.5 is the FSI for construction of hospitals in states for a long time. IT parks and hospitals get that. There is subsidized electricity, subsidized water, but that's one part of the game. Kiran Mazumdar-Shaw just said she wanted more participation of the private sector. What can the central government do to ensure more participation? Do you have a view on that?
I think that the central government, more than anything else, needs to signal and reiterate its commitment to universal healthcare and its articulation of a commitment for access to quality health for all. And in that, be open to creating a regulatory environment as well as a provision environment that allows all players to enter and ensure that the patient, the citizen, is protected. That means strong regulation. That means openness to partnerships. That also means a commitment to investing in its own hospitals in order to create a competitive ecosystem so that citizens have a choice and that a choice that is genuine, accessible, and equitable.
Okay. Moving on, we'll come back shortly.
I just wanted to add to that. I think one of the new methodologies of doing this is through a managed care model. Because I think what it does is it basically disincentivizes people to try and basically game the system and charge the patient more. So when you have to manage the care within a cost, then there is a compelling self-interest to keep the patient cost low, and we have to also make sure that the patient is kept in a state of wellness, and then the whole impact and outcome assessment is done in a much better way, but that's a separate discussion. So I think those are different models of healthcare, and I think the government ought to look at many of these things if they want to stretch their resources in a much more effective way.
I'll come back to one insurance question with Kiran Mazumdar, Yamini, but before that, I'll go to Vijay Agarwal. We have come from health now to taxation. There was this talk on abolition of adjudicating authority in the Benami Act. Could you decode it for us? Because this is what has been in the gossip corridors for the past 2 days now.
See, firstly, this budget was a pleasant surprise. For last 30 years since I got enrolled in CA, I used to have my office boy standing in the Connaught Place to get the first copy of the budget, hard copy. And this time we had it all on our mobile phones on the app. So I was very excited. But when I opened it and went to the last pages, there was this disappointment in the sense that the government must understand under the Benami Act, which they have introduced, we have the adjudicating authority, which used to handle the cases of Prevention of Money Laundering Act. Now, in this budget 2021, they have abolished that adjudicating authority and replaced it with a competent authority, which is there in SAFEMA. There is a talk in the corridor because in SAFEMA, the person heading the authority, who is in fact a judge, because now we are having the trend of tribalization in the country to reduce the workload in the judiciary. So there the person himself is an executive. He is an officer of the rank of around joint secretary and above. So they are making an executive a judge that is against the basic principles of law. That is completely ludicrous that you have an executive judging the act of an executive, because under the PMLA Act, adjudicating authority person is a person who qualifies to be a district judge. So now they have the Babu becoming a judge, so which is basic deviation from the whole concept. So that is what is disappointing for we as lawyers. And see, all lawyers of all statures is going to come for the executive. He will not know how to deal with the lawyers. He will not know the stature. So it would be like a bull entering a china shop. The executive won't be able to handle the judges of the lawyers. So that's
okay. Do you think this will be challenged?
100% this will be challenged, and I don't think that this is going to meet the judicial challenge at all.
Okay. Point well taken. I'll go to
this concept. The problem is this concept that rather than having, say, you have lots of retired judges, you have lots of retired High Court judges, you have lots of retired Supreme Court judges, you have lots of retired district judges. So having an executive judge the executive act of the government is ludicrous.
Okay. Point taken. We will talk more on this. I'll go to Mr. Gagan Kumar. Could you also you also happen to be a chartered accountant in addition to being a lawyer? Could you decode the financial fine print of the budget for us?
Well, Tarun, as they say that law is a tool of social engineering in a society. And through laws, typically the tax laws, the consumption and investment habits are re-engineered. Now, if we look at the biggest challenge which as an Indian society we always faced is that of certainty, be it the train departure time or be it reaching office on time. One important aspect which this budget has achieved is the stability and tax rates. So in a way, government has done its bit in terms of bringing about stability in the tax laws. Now, the other crucial aspect in tax laws is the tax administration and the certainty around it. As they say that a stable society is built on the notion of fairness and justice. There is a paradigm shift now in that direction also. And I'll just list out these few amendments which have been proposed. The first and foremost is the period for reopening the tax assessment has been brought down to 3 years. The second is that the tax assessment period itself has been reduced to 9 months, which is very practical. Third is the adoption of non-confrontational approach by way of setting up dispute resolution committee, which would settle disputes up to 10 lakh rupees. So the small taxpayers need not be hassled. They can sit across the table and settle the dispute per se. Now, the other major change, which is in continuation from the previous budget, is the faceless scheme of tax administration. Tax assessments are already going through faceless scheme. First appeal is also going through faceless scheme. Now, the tax tribunal has also been suggested to go on a faceless mechanism, except where the parties would insist to have a hearing. And in that case also, it would be a virtual hearing, not a physical hearing. Now, obviously, it reduces burden on the other benches because some benches are less on workload, some are more burdened with the tax load. Now, coming to the second aspect, which is the ambiguity in law, and certain steps have been taken to eschew that also. Like, for example, and probably Kiranji would appreciate that more, the secondary adjustment on account of transfer pricing adjustments or the advanced pricing agreement. So the law came in about a couple of years back that if there would be an adjustment on transfer pricing audit, the books also have to reflect that. And that would happen, that would result in a situation where the book profit for the subsequent year would be higher. So that has been taken out of the purview of what we call minimum alternative tax, or the MAT as we commonly call it. The other important aspect is that certain tax disputes which were which went up to Supreme Court and which were sort of very running on a very fine line of tax evasion vis-a-vis tax planning, like depreciation on goodwill in case of merger and amalgamation. So Supreme Court said that yes, it is allowable, but now department has clarified that it will not be allowable. Similarly, challenges were being faced for the delayed payment of PF and ESI. So law has been clarified that you have to abide by the limitation period given under the respective statute. Lastly, there was a lot of tax planning was going on by way of slump sale on transfer basis and not on a cash basis. So there were many judgments from various high courts which said that that is not a slump sale and hence not a taxable transfer. So those have been taken care of. There are few points where fine prints need to be read, and there are areas which government would have to look into. And I'll echo the point raised by Vijayji on one of the aspects, is the authority for advance ruling has been dismantled. Now it has been replaced with the Board of Advance Ruling. And how it has been replaced? The earlier constitution of authority for advance ruling used to have a retired Supreme Court judge. Now it will be manned by 2 senior officers of the Revenue Department. Now, the position doesn't stop here. The challenge would be that now it is not binding on the tax department. So the very purpose of seeking advance ruling would get defeated. So any multinational company which is seeking an advance ruling to have certainty on tax law, so while many steps have been taken to ensure that there is adequate certainty in tax law, this one step really takes a step back. The other challenge is that it is appealable by the revenue itself. So that itself poses a question on the sanctity of such an advance ruling where department, not only it would not be binding on it, can also go and challenge also.
We'll go to Vijay Agarwal and I'll come back to Kiran Mazumdar-Shaw in a bit. Yes, Mr. Agarwal, you had to make a point.
So bigger picture is to be looked at, that now they do not want, the executive does not want to get judged by the judiciary. They want themselves to become judges. This is conceptually wrong. So wherever you earlier they said that, okay, we want to reduce the burden on the sitting judges. So everywhere when you were agreed by the act of the executive, you were going to the court. They said, no, we will form a tribunal. So now please see the design that now the tribunal's heads are being replaced by the executive. So the government officer says, whatever I did is right, because they've all worked together at some point in time and they have access to each other. So the judiciary has to be completely free, impartial, and the judiciary will judge the act of the executive. Executive judging as executive is completely wrong. And
Okay. Point taken.
Judges also.
I'll go to Kiran Mazumdar-Shaw. Coming back to the insurance question, we're talking of 74% FDI and insurance. We are one of the most underinsured countries, though it is coming up. Do you think that will help the health sector in standardizing? Because currently the cap had ensured that a lot of companies kept away.
Well, certainly it's a good decision to increase the cap to 74%. But I think basically we have to look at who's going to rush into the space. Is the whole unless we make insurance a very large and a sector which actually has a kind of an insurance premium that gives them a good return, I don't think people are going to really rush in. It is a very large market. But I think we have to understand, first and foremost, there has to be continuity of policy. We have to make sure that and it is a very important area. Insurance is a very important area, especially for healthcare. So if we can actually attract investment from, and I believe that there is a lot of interest from, especially the Southeast Asian, sort of insurance companies, they might be really interested to invest in India. I think that could be quite interesting, because I think healthcare will need a large insurance mechanism. But on the other hand, we have to make sure that insurance doesn't become a stumbling block in really the healthcare, universal healthcare system. Because, all the eligibility and payouts, these are all becoming really, really big challenges. And that's why I say that if you go back to a managed care model, that might work better than just an insurance and reimbursement kind of a model. So a lot of companies in many parts of the world are turning to managed care as opposed to just a straight insurance model.
Okay.
Maybe Yamini can elaborate on that more.
Yamini, would you have add to what Kiran Mazumdar-Shaw said?
Yeah, I think one of the things that we need to really think about on insurance is about the overall regulatory ecosystem and the architecture that we have built that we need actually to ensure a strong to ensure an environment that it gives both credibility and stability that may attract the private sector and attract FDI in this particular instance, but also ensure that there is transparency and an appropriate environment to address the very complex issue of pricing and of consumer redressal. And I don't think that the regulatory architecture has been thought through effectively. I also don't think that the regulatory architecture is robust enough in its current structure, and our ability to manage these very complex things. Think about it as simple HR, back of the envelope calculations that a colleague and I did about a year ago. Medicare and Mediclaim in the US has at minimum in Baltimore, in Washington, about 4,000 employees looking at claims data to get a better understanding of the dynamic of pricing in the market. Back of the envelope calculations of who people's the health insurance trusts that the government is running under Ayushman Bharat, or what at the time was the RSBY, it can range from 5 people in Bihar to 200 people in Andhra Pradesh. So our own governance capacity to just at a very, very basic level, do we have the right amount of staff in the right amount of places to be able to do the things that you need to do to manage a effective insurance structure? We don't have. We don't even look at claims data currently in our own government-run health insurance programs because we don't have the staff and the capacity to do so. So thinking through the regulatory architecture so that there is credibility stability and predictability to attract the finances that you need to be able to run insurance, as well as to ensure that there is protection for the patient, the citizen, is essential as we look forward to what will eventually emerge as a robust tertiary sector.
Okay, point well taken. Maybe we need one more discussion on the insurance sector. I also need to understand it a bit better. But thank you so much, Yamini, Kiran Muzumdar-Shaw, Gagan Kumar, and Advocate Vijay Agarwal for participating in today's episode of Policy and Politics. We are totally out of time. So, but maybe we can take a quick comment from Gagan Kumar. You had to say something, but in about 15 seconds.
Yeah, I'll complete it in 15 seconds. And I just wanted to highlight one or couple of serious concerns on the power of executive under the GST law. The law has been amended in a manner that now there can be a provisional attachment of the bank account of the taxpayer upon assessment or search or recovery proceeding, and which may remain valid up to 1 year after the completion of the proceedings. Secondly, there's a all-empowering section has been introduced whereby the commissioner can demand any information, so which is unbridled power, so which need to be brought into checks and balance need to be built in. So these are the provisions which probably industry body may take up with the finance ministry.
Okay, thank you. Thank you so much for this point. Thank you all of you for sparing time for this episode of Policy and Politics. Bye for this week. Thank you. Thank you.
Thank you.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.